Everybody. So good morning. Thank you so much for everybody's patience. Of course, never computer issues until a time when you're presenting. So hopefully some of you can sympathize with that. So today when we talk about interprofessional teams, my role today is to talk about the patient. And so for many years, I was a health literacy advocate and educator, as well as a medical research librarian for a large hospital system. And my role was assisting patients and their families in collecting, understanding, and then using health research and information. So today I'm going to talk about the patient's role in this. So this is me, Jessica Daly. I work for AdventHealth University, which is a health sciences university. The way I put it in a nutshell is we do every type of health professional degree except for MD. So we even do physician assistant, all the types of therapy, nursing, radiography, you name it, we cover that. So I assist these students in their journey to become a healthcare professional. And so a lot of things that I do within the library and the university help to make sure that happens. So the first thing I'm going to say from experience as a caregiver, and I know you can relate, is that being a patient is difficult. I love that for 18 years, my husband has been a cardiac patient. I've been his sole caregiver. And several years back, I had an emergency appendectomy, and it was a very scary situation. He was not used to me being the patient and him being the caregiver. And so I found that they're completely different roles and that it is not easy being the patient. It is not easy understanding that something is wrong, receiving a diagnosis that you didn't expect, using, all the different things that go into it. And so it really is difficult being a patient. And that's the first thing that I want to say before we get into anything else. So what is the patient's role within the healthcare team? It really is a role that is, I think, most important above any other role, because this is this person's health, it's their body. And without their help, healthcare professionals, no matter how good they are, how experienced, how successful, you can't receive ultimate care. You can't improve your health. You can't improve your quality of life unless you become a very active participant in your healthcare team. So it really is important for you to be a very clear communicator. And so it is very important for you to explain your specific needs, your preferences, what makes you comfortable, what makes you uncomfortable. And so when patients don't do this, then that leaves the healthcare professional guessing, trying to ask questions to learn these things. So I really promote with patients and with caregivers how important it is for you to share your concerns and communicate those needs. So patient safety is always top priority, or it should be in every healthcare facility of any size or any type. But ensuring patient safety is actually a national priority. You're legally bound to do that as a healthcare provider, but patients can make their experience safer by becoming more active in their care, keeping their healthcare team informed about everything they're feeling, everything that's happening. So patient self-education is very key to this. You're not going to always get all the information that you need from your healthcare provider, or you may not really know what to ask them until after you get home, you're able to process things, you're able to then understand, what is it that I want to learn more about? What don't I understand? So the information that patients receive is key, and making sure that it is written for them or created with them in mind, and also making sure that it's in a format that they can use. So for instance, many of my patients were illiterate, could not read. So it was very key for me to gain access to auditory or video information for them. The other aspect of this is making sure, of course, that you use your native language, that you let them know what your native language is. Even if you're very fluent in English, but that is not your primary, language that you use, especially if that's what you don't, not what you use within your home. Is so important to make sure that you receive information in both your native language as well as English. And this goes for medical results, for test results. So you may have to continue to remind healthcare professionals as a patient that you need those things. And then patient documentation is so key, that we encourage patients to document things, to take notes, to maybe even ask for permission, but record in talks on their phone. Make sure that they understand that with permission, they could do a FaceTime with a family member so that they could hear the information as well. But it's so important to have documentation to refer back to, especially if you're going to look up things about your health after an appointment. And then keeping track of and sharing. So it's very important for you to keep track of all your information as a patient in one location. And so it's also important for a caregiver and a patient to have that relationship and know that anything is going to go in this folder, or anything's going to go in this section within the drawer in the kitchen, knowing where all of your information is so that you can go back, so that you can make sure you take all that information to a new doctor visit or when you see a specialist. So medications should be listed there, any hospitalizations, really all of your health history is so important to have that in one location. And then being familiar with your treatment. I have a CPAP here because many patients use a CPAP. My own husband does, but you need to know how to use different equipment. You need to make sure that you've been trained before you go home. Make sure that you have all the contact information so that when a patient gets home, they can then call or email or do whatever method they need to ask questions. And then I always talk about a second opinion. That is key. Anytime you're going to have a treatment, a surgery, even if you've had a diagnosis and you would like a second opinion, I encourage patients to do so. And I also tell them, a lot of patients would say to me over the years, Jessica, I don't want to offend my physician. And I said, any physician that is a good physician and a reputable physician will even encourage you to get a second opinion. If they become upset because you want a second opinion, that is a huge red flag. And then asking for help from an advocate. I really encourage patients to have someone that they trust that can help them, whether it's staying with them in the hospital, going over treatment, just discussing what was said in an appointment, or even looking for who to call in different situations. So it really is important to have that advocate, even for people that are very private people. It is important to have that person with you so that you have that support that you need. And in closing, I know this has been a lot really fast on the patient end, but the entire healthcare team includes patients. And so that is something that I really, spoke to so many patients and so many healthcare professionals over the years, that the patient is the key to everything that is done. So the patient is part of this interprofessional team and a key role. So I will hand it over to our next speaker on the panel.
Does anyone have any quick questions they want to throw in for Jessica before we move on to our next portion? Okay. Well, then I'll go ahead and introduce Terri Johnson, the medical librarian for Florida State University.
Hello everyone. Let me share my screen. And I hope everyone can see that. Like Allison said, my name is Terri Johnson. I am the medical informatics librarian at Florida State University, Maguire Medical Library. And I'm going to give you kind of an overview of how we teach medical students patient education, health literacy, and trying to train them early in their careers on how to talk to patients. And when we tell them about patient health literacy, and we explain to them that's the degree to which individuals have the ability to find, understand, and process information about their health. Also, they have to worry about or start thinking about digital health literacy, because as you know, Dr. Google, students or patients will talk to Dr. Google before they go to their doctors, and then they might not necessarily understand what they're seeing, or really the librarian in me is like, they don't pay, look at the information that they're finding. They don't check the resources of where it's at or pay much attention to that. And then when we talk about patient education, it's their ability to help a patient change an activity and how they can be in the process of implementing, this change in activity for the patient. We also express that they need patient-centered communication. And when we say patient-centered communication, we talk about their communication skills. How do they talk with the patient? Asking open-ended questions to the patient. Don't interrupt them. Let them tell their story, and the doctor needs to listen to the patient and then try to understand the patient's perspective, what their feelings and maybe their beliefs, and show empathy. The doctor needs to show empathy to the patients and respect them. Give them treatment options and bring the patient and let them help decide. Show them, these are the options we have, and, how do you feel about this? And before the diagnosis, can it relate to anything? Just help them understand it. And after the diagnosis, just see how things are going and check up on them. Okay, they have to address the knowledge deficit. So relating the patient, letting them relate to what is wrong with new information, existing to what they have, and then how this affects it. Use analogies. Try to be brief to them. And the doctor needs to use understandable language, not medical jargon. And if they give them a patient education handout, it needs to be on a 5th to 7th grade reading level, and that's for everyone. Use audiovisual aids if possible, diagrams, encourage the patient to talk to you, ask questions, and then summarize things. The handout needs to have summary points on it. One thing we do with the med students is we give them a memory test, which we're not going to do that today. I'm not going to tempt fate with that, flipping over to the internet. But the memory test it shows a bunch of different items. And I have the students look at it for about a minute or so, turn it off, and then ask the students, what do you remember? What pictures did you see? And they write down, and then I'll say, okay, now imagine someone just gave you some life-changing information. How is your memory going to work? Are you going to be able to remember that? Or are you just going to think, oh my gosh, how my life is going to change? And another thing they need to worry about is a senior patient might have hearing difficulty. And I do know a lot of elderly people that will probably just nod their heads and agree with you, and maybe not really hear or understand what you're saying to them. Okay, and once again, avoid medical terminology. And we really, stress that a lot with them. It's not appropriate. If you are writing it on an order to give to another medical professional, yes, but acronyms, the patient is not going, might not understand. They might, but then again, they might not. So talk plain language. talking to a patient. You know, simple words. And when I talk about medical jargon, I show the students, this is what I mean when I say medical jargon. Edema, you tell someone they have edema in their leg. They might not understand edema, but you got too much fluid in your leg and that's why it's swollen. That is a more understandable way of communicating with the patient. I'm going to show you a little video and hopefully it will work. And this is just something that we demonstrate to the med students on communication skills and how things might go awry.
Well, sometimes doctors make mistakes. Anna, you have to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Okay, that's just a real far out example, but evidently this patient didn't have the correct patient education and didn't get trained properly. And we tell the students, we're to do open-ended questions, show me how you're doing this and tell me what you know about asthma, so open-ended questions. That's, we really try to let them know that. And then skill training, use the inhale. How do you use it? Someone needs to sit down, either give them the material to learn how to do it or sit with the patient and have them show you, demonstrate how to do it. And that goes with blood pressure and insulin shots, glucose testing. On a personal note, I was prescribed, I needed to take a B12 shot every week is what my doctor told me. And basically it was like, okay, you need to do this and was gone. I kind of freaked out. I'm scared of needles. Maybe he thought that I work at the med school. I can find someone to give me a shot. I don't know. It's been a nightmare till finally we had to change the program for me because Terri can't do that. Terri can't stick a needle in her arm or her leg or her stomach. It kind of freaked me out. And nobody really took the time to sit down with me to demonstrate it. It's going to be okay. So that's something that you need to, I tell the students, you really need to sit down and have either yourself or a staff member, the nurse or someone demonstrate things to your patients, observe them, this is how you do it. Now let me watch you do it. Which in today, they're in and out of the, physicians have so many patients now. So it's hard to take time. So you have to train the staff and communicate with the staff to know what they're doing and get them to do it. Okay, you never assume that someone reads on the level of their education. And that's just a given. They may, but then they might not understand medicine or medical terminology. Someone could be a native Spanish speaker, which we deal a lot with that in the state of Florida. And a lot of our resources that we have for patient education can be translated pretty easily into another language. So that's something that we drive home to the students that, you need to be aware of this. Don't have more than 2 pages on your patient education handout. Pictures are very helpful. Pictures, well, they say a picture's worth 1,000 words. So having illustrations or pictures in your patient education is also a plus. And the font size, the fonts, the larger font, the older you get, the more you can appreciate having a larger font. Okay, the reading level, it's hard to assess reading level in the office. So having your handouts, be prepared for everyone and make them, like we said, 5th to 7th grade, 1 to 2 syllable words, 1 idea per sentence, 1 concept per paragraph, and key points. And once again, avoiding medical terminology, if at all possible. Okay, there are websites out there that we show them where you can check the readability of a website. So you can plug in, you get your URL, go to this website, and it will scan the website and let you know what the reading level of it is, which could be helpful if you're prescribing or telling a patient to go to that website. We demonstrate how to use the handout, train the staff, or if you've got, medical students, sit next to the patient, review with the patient, give them something to write with if needed, point at things, communicate, ask the open-ended questions. Do they understand? Have them, demonstrate what you've told them. I just told you this. When you get home, how are you going to tell your spouse what we discussed? These are things to to make sure people understand that what you've communicated with them. And here's my resources. And if anyone has any questions, let me know. But this is the general way of how a little smidge of what we do with the med students. And they break, after we talk about all this, the students go to a small group activity where they practice with an inhaler, showing the patient, they demonstrate. So that's what we try to do to get them prepared.
Well, thank you, ma'am. I just wanted to be connected. So thank you.
Okay. Yes, I see that we've got a question about the website, and I think you can get it. I can put it in the chat, the website that I use, but I think the handout's going to be available.
I've just put the website in the chat. Sorry for the delay.
Okay, all right, great. Okay. Okay, with us, with informatics, it's more informatics education is what we do. And I focus mainly on clinical resource. So it's using technology in the clinical setting with our clinical tools. I don't know if that's answering your questions. I don't get into the data mining and that type of information. And if we want, Dr. Blue can go ahead and start talking. I will go through the chat and put stuff in the chat, answer questions in the chat if possible.
Okay, thank you, Terri. Now, our final presenter, Dr. Amy Blue, Associate Vice President of Interprofessional Education at the University of Florida.
Great, and thank you all. And I really appreciated hearing what Jessica and Terri had to say. Hopefully, if I do my job correctly, I'm going to reinforce a lot of what they've heard, and I'm hoping everybody sees my slides. Is that correct?
Yeah, we can see.
Okay, so I'm going to, again, as I just said, probably hopefully reinforce some key points that they had and talk about the interprofessional team within this broader context of improving health literacy through interprofessional communication. And I hope in the brief time I have with you today to kind of highlight a few key things. One is to just inform you again, what is interprofessional collaborative practice? Then have you be able to identify some communication and specific teamwork tools that will help, I think, help improve with health literacy in interprofessional teams. And then also discuss the value of psychological safety. So let's first of all talk about interprofessional teamwork, or as I said, interprofessional collaborative practice. And this definition that you see here, I want to point out, is from the World Health Organization, which means interprofessional education, which is really my world, and interprofessional collaborative practice, which I know both Terri and Jessica, work in as well. This is not simply a Florida or United States phenomenon or North America. It truly is global in scope. So, common definition when people are talking about interprofessional collaborative practice is when multiple health workers from different professional backgrounds work together with patients, families, and communities to deliver the highest quality of care. And I highlighted the work together with patients, families, and communities. And Jessica was telling us exactly what happens in interprofessional teamwork is the patient and their family are members of the team. Now, many years ago, a group formed, it's called the Interprofessional Education Collaborative, and it's based from the various health professions education associations. They came up with a set of interprofessional collaborative practice competencies. And in November of this year, they released version 3. The first version came out in 2011, and things have changed slightly since 2011, really to just recognize the changes that have been going on in our healthcare system in the United States. But much of the spirit and basic skills and concepts that were established in 2011 still remain today in 2023. And within a broad competency of interprofessional collaboration, it was broken into kind of 4, I'm going to use the term domain areas. One is around values and ethics. Another is around roles and responsibilities. One is around communication, which is pertinent to what we're talking about right now. And the other is around teams and teamwork. And with that subcompetency around communication, here I've just put in hopefully easier to read font, what that is. And so as an interprofessional collaborative team member, you should be able to communicate in a responsive, responsible, respectful, and compassionate manner with team members. Again, remember what Jessica was telling us, your patients are team members as well. And within this kind of broad sub-competency are additional competencies. I didn't list them all, partly because of relevance and time that we have, but I pulled out 2 that I think are specifically relevant for this particular conversation. One is to use communication tools, techniques, and technologies to enhance team function, well-being, and health outcomes. And both Jessica and Terri gave us some wonderful tips around communication tools and techniques, and particularly to ensure that patient-centered care. Another one is to communicate clearly with authenticity and cultural humility, avoiding discipline-specific terminology. And I'm going to be reinforcing Terri's point about the use of jargon. So if folks would just share in the chat, when you hear someone say, or maybe you read, patient experienced SA, what might you think about? And let's see if I can. So yeah, I would just appreciate it if people would put in the chat when they hear this, what people might be thinking about. We've had a few people put some things in. And we have a common theme here, which is interesting. And also very important. So sexual assault, sexual abuse. I don't know, maybe someone just stole what I was going to say, perhaps social anxiety or substance abuse. or abuse. Anybody think of sinus arrhythmia? That could be if you're working in cardiology, you may think of that. My point here with this, and it's going back to completely reinforce what Terri teaches the medical students, is acronyms and jargon can end up being confusing for patients. What I'm going to say is not only for patients, but for members of your healthcare team, even coming from different professionals. And I think we just saw that illustrated because we're all coming from different professional lenses here in this conference. Some of us were thinking very, very different terms when we heard that abbreviation of SA. So, reminder, beware of jargon. And as we know, it's a vocabulary particular to a certain trade or profession or group, and each health profession does have its own jargon. And it may kind of, but not always translate to the other health professions as well. And really, jargon is simply a second language to shorten communication within that group, again, within that particular profession. So maybe it's physician to physician, or physician assistant to physician assistant, physical therapist to physical therapist, etc. And as we've already been reminded of, it can also create confusion, as I've been saying, among health professionals, but patients and their families. And an interesting study that was published, and I know Jessica and probably even Terri could tell us a lot more, even common phrases may not be well understood by patients and their families. And that's why Terri's slide with kind of medical terminology, how to make it plain language, really is so important. And I'm going to also say, and not go down the tangent because I'm watching time, even cultural expressions that both Terri and Jessica alluded to can also create confusion between patients and healthcare providers. And my understanding of the agenda for today is there should be a really great session following this set of breakouts around cultural and language issues and health literacy. So it's important to avoid jargon and then be able to explain and clarify when maybe it's happened on purpose and or happened by accident. Which brings me to my next tool that I want you all to be aware of. And this is one that's just good for effective teamwork in general. And it's making sure that everyone on the team, again, including the patient and family, has the same shared mental model. And the shorthand for that concept is making sure everyone is on the same page. It's the perception of, understanding of, or knowledge about a situation or a process that is shared among team members through communication. And with this picture, our healthcare team of penguins, they're all thinking of the same big fish. And if they're really being precise with their language and not using jargon, they are thinking of exactly the same type of big fish. And so having people understand, being on the same page, having that same shared mental model is critical to effective healthcare teamwork and ultimately patient safety. And I think Jessica alluded to that as well. So some communication techniques, just as a reminder for ensuring your team is all on the same page, is paraphrasing. Maybe someone has said something and you want to make sure everybody on the team understands that. So you may paraphrase it using plainer language to say what you're saying is. Or maybe you've heard a term or that you don't understand, or you think others on the team may not understand very well. And so you may ask a clarifying question. Can you clarify for me what SA is meaning within this context? Or how do you mean, or what do you mean by the term SA? And these are all ways of perception checking around the use of language, the use of terminology, everyone's understanding. And again, the whole goal is to make sure that your healthcare team, again, including your patient and family, has the same shared mental model. They all understand what's going on. Generally, this is in regards to a treatment plan, but it could be something else that the team is discussing. Now, looking at this picture, I'm imagining most of us would not want to ask a clarifying question. In fact, maybe that happened here on this team, okay? intentionally chose this to maybe show a team in which there might be some tension, a little perplexity, obviously someone who's not happy, and I imagine could be yelling at another team member. And again, I'm thinking this is a team where at least I myself would probably not want to readily acknowledge, I don't understand what a word or term or phrase is. Which leads us to the next concept that I wanted everybody to walk away with, and which is key to effective interprofessional and just effective teams. And that concept is called psychological safety. It was coined by Amy Edmondson and colleagues many years ago. Amy Edmondson's at the Harvard Business School. And basically, a shorthand definition is that it's the degree to which people view the environment as conducive to interpersonally risky behaviors like speaking up or asking for help. And again, in this context, saying, I'm not sure, I've heard that term SA before, but I know it can mean different things. Can you please explain to me or clarify for me what you think it is? Again, a psychologically safe team, asking that question is second nature. And unpsychologically safe.
Arguing with your father?
Unlike-
No, I don't argue. I never argue.
And so when we're thinking about creating psychologically safe environments, it's a responsibility of all team members, particularly when you're a patient and their family member is on the team and you're one of the healthcare providers. But first of all, being nice actually is important. It really does matter. There's an interesting line of research that I won't, in the interest of time, go into a lot of detail about. But there has been research to show the effect of the rude team member on the team. And as I would think you wouldn't be surprised, it's not good. Rudeness actually impacts in a negative way the creativity and problem-solving abilities of a team. It can actually kind of disrupt the working memory of the person it's been directed to, even if just for a few seconds. And think about that when someone might be doing a technical skill and someone is yelling at them about how they're doing it. And the other thing about rudeness on a team is that it is contagious. Those who see it are affected by it and they can pick it up, and then one can begin to imagine just then the development of a pretty negative team environment. So if nothing else, if you're kind of having one of those days, it's just important to be nice when you're on the team. But some other specific tips for promoting and enhancing psychological safety on a team is, first of all, recognize everyone has something to contribute. And I think it was, as Jessica said, this is so important. We need to recognize what our patients and their family members have to contribute. They know best what's going on with themselves as the patient. But there are going to be other team members that a lot of times we don't realize. Maybe it's the receptionist in that outpatient clinic who is understanding why someone is running late all the time, or the ward clerk in the hospital, or maybe even somebody from housekeeping who has seen some patient interactions. Everyone has something to contribute. For many of us on teams, we really don't like conflict, and we may try to avoid it, and therefore we don't want to speak up. And once you begin to realize that actually conflict, not like in that picture I showed before, but just sort of differences of opinion, actually can be very helpful in terms of thinking about ways to innovate or improve, or to see something that may just have been really missing that's going to help with patient treatment. So it's important to recognize in a team, voicing differences of opinion is actually helpful. And what you want to do is find common ground within those differences, and then begin to have discussions from there to see how, oh, well, we didn't think of this. Maybe we can begin to resolve this in a different way. Another real key point about promoting psychological safety in a team is to avoid blame. And I hate to say, sometimes in our own brains, we can think of this in a very easy way. And I encourage us all to avoid doing that. Most of the time, we don't know enough about the context of what someone might be saying or why they may be acting the way they are to really know what's going on, which is why I have sort of a shorthand quote I'd heard many years ago. If you don't understand what is going on, you don't have enough history about the situation. Maybe you have a team member who continues to ask clarifying questions to help make sure everybody's on the same page. And maybe they're doing that because recently they were involved in a patient safety event that didn't go well. And through a root cause analysis, they found out that it was a lack of shared communication and, clarifying jargon that led to that. And so they're even more aware of the need to make sure everybody on the team is promoting health literacy. So again, don't always just jump to quick conclusions and blame someone. Just kind of rest with, okay, they're doing this for a reason. I don't understand that right now. I may not fully understand it, but let's continue the conversations. And finally, another way to promote psychological safety on a team that many will talk about, particularly if you're the team leader, either the designated or the situational, is to role model that comfort with uncertainty. Maybe is there something else we need to be thinking about, you might ask, as a team leader or a team member? Again, you being the person is asking that clarifying question, asking the team as a team for feedback. How are we doing? But the idea is to role model that fallibility, that sort of, particularly if you're in that leadership role modeling, I'm leader here, but I'm not going to know everything. And I need help from the team so that we can all stay on the same page. So we all understand the language that we're using so that we all can help each other best in order to help the patient who is also a member of this team. So again, some ways to promote psychological safety. So in conclusion, what I want you to think about, and I hopefully have reinforced many of the points that Jessica and Terri shared with us, for an effective interprofessional communication when we're dealing with interprofessional healthcare teams, is one, we always want to promote health literacy. We want to do that by minimizing the use of jargon, and when it's happened, to clarify it. We need to make sure all of us on the team have a shared mental model. And again, we're going to do that best by minimizing jargon, clarifying communication. And in order to do that most effectively, we want to create psychologically safe environments where everybody feels comfortable speaking up and sharing their perspectives and their opinions on what is going on. And with that, I know you will have my slides and you'll have the references. And I think I will stop sharing screen and see what questions people might have, and or turn it over to Allison for